So, a lot of these symptoms sound like they're really debilitating in life. Talking about nerve pain and panic attacks and all of these digestive issues. Um, I imagine you guys are changing a lot of lives at Root Cause. Um, what are
Yeah,
you
absolutely.
doing to provide relief for your patients when they're coming in?
Yeah, thank you for that. We do provide really the resolution, which is what I love to make the distinction between relief and resolution. Um, Number one is appreciating that a lot of patients are being given a lot of different medications that are completely unnecessary. They're given antacids that actually cause a lot of imbalance in digestion the longer you're on them. They're given inhalers. A quick story, we had a young man in his 20s. He's in college, an athlete. He's on a sports team, and he's 22 years old. And granted, he had a history of digestive problems most of his life, but sort of it crept up on him to the point where his big symptom was he couldn't catch a breath. I mean, he not only couldn't do his sport, he couldn't even walk around without shortness of breath. When I spoke to him, he said, "This is it. My life is over. I can't breathe." And what happened was he went to all these doctors, and even though there was nothing physically wrong with his lungs, they still put him on an inhaler because he couldn't breathe. Now, what an inhaler does is it's a steroid, and it tends to raise your heart rate. And what happened for him was he got on the inhaler, and because the root cause of the problem was not the lungs, his panic attacks and his heart palpitations got worse. So then he felt 10 times worse on this drug, and it was all coming from his digestion. So that's what we do is we teach person, they get a personalized program of, okay, you have this list of symptoms, but why? Well, how did you get there? There's the woman who's had a baby, and everything kind of gets pushed up when you have a baby, and after the baby things didn't normalize. Or someone lift something really heavy, they're athletic, and they lifted some weights wrong, and they strained everything in their core, and that created the problem. And again, more commonly, you've got the digestive imbalances of a poor diet and food reactions, and actually infections that can be present in the gut. And then lastly, you have the fact that all of this stress on the on your system, which makes your heart pound and you're short of breath, creates a lot of imbalance in stress hormones. So the body is secreting all these stress hormones because you're not getting enough oxygen. And so we have to those as well. And even though it was a secondary response to the problem, we still have now an imbalance of stress hormones. So someone's feeling anxious, they're not sleeping well. So all of that is addressed naturally without any drugs or surgery.